Hi everyone, welcome back to my channel. What's up? My name is Kendra. I'm a physician assistant in cosmetic dermatology, and today I'm going to be talking about healthcare experience for physician assistant school. So I already recorded this video once, and when I started editing it, I realized how boring it was because I was literally just listing what different jobs would count as healthcare experience, and that is boring. So I'm just going to list all of the jobs that are considered patient care experience and healthcare experience down below for you guys to easily look over. But the main point of this video today is to go over the difference between patient care experience and healthcare experience, when you should start getting hours for both of them, and how to go about getting a job to fulfill these hours. So the main difference between patient care experience and healthcare experience is that with patient care experience, you have direct contact with patients and you are assisting them or doing something directly related to their care. Healthcare experience is going to be anything outside of that in the healthcare field. So being a front desk clerk or patient transport or delivering food to patients, things like that. So an example of patient care experience for myself is that I was a medical assistant in plastic surgery, and I used to help remove sutures, remove staples. I assisted in minor procedures. I took vital signs. I drew blood. So all of these things had to do with direct patient contact. So if you have any question of whether or not your experience is going to count for the PCEs, then you can ask yourself, am I directly helping patients? Am I assisting them doing things or not? But really, it's pretty self-explanatory. And if you have any question about your job and whether or not it does count for patient contact experience, then I would contact the schools that you're interested in and double check just to make sure so that you're not wasting your time. How many hours should you have for PA school? This is really dependent on which school you're applying to. Not all schools require patient care experience. Some of them don't require it at all. Some of them say it's just recommended, and then there is some that require a certain amount, say from like 500 to 2,000. But generally, most people who apply and are successful at getting in have at least 2,000 hours. Some people ask if healthcare experience and patient care experience can count as the same thing, and the answer is no. If you have a job where you're doing both, then you would have to split the hours between the time that you spent doing patient care experience and the time that you did doing healthcare experience. Another question that I get is, when should I start getting my healthcare experience? And the answer to that is as soon as humanly possible, because the more hours you have and the more experience you have, the more competitive of a candidate you are for PA school. Really building a medical knowledge before you even get to PA school is very helpful and makes you stand out against all the other people who are applying. So how do you go about finding healthcare experience? So for me, I personally just applied to every medical assistant job that I could find. I mostly applied to jobs that were office-based because not all of those jobs require certification. So I just tested my luck. I gave them a cover letter explaining what my intentions were, what my aspirations were, and generally they would like that because honestly, it's tough to find good medical assistant help in terms of them actually being passionate about their jobs. So I got lucky with that. I applied to a lot of different jobs and I was successful getting an OBGYN job and also a plastic surgery job. But if you try that out and it doesn't work, another way you can get into the medical field is just by volunteering. So some schools actually accept volunteering as healthcare experience. So if you go to a hospital, you just go and ask if they have any volunteer positions available. So that way you now have an open door to meeting new people and finding out if there are jobs that are accepting students and people who are interested in going into the medical field in the future. Another thing that counts as patient care experience that I just wanted to throw in really quick is going on mission trips. This really makes you stand out because you're going and you're helping, and you're also having really direct hands-on work in a place of need, and it really shows how much you care and really makes you stand out. The last question I get about healthcare experience is that if shadowing a PA counts as healthcare experience. The answer is no. They're two different things. If you worked and were able to shadow a PA as well because you worked with them, I would separate the time of actually working and doing your job from the time you spent shadowing and following around the physician assistant. So one last thing I wanted to briefly go over is what I consider as quality patient care experience. Again, this is just my opinion, but the jobs that I think are quality patient care experience are going to be medical assistant, an EMT or paramedic, a respiratory therapist, or a nurse. So all of these jobs work directly with PAs, or they teach you about things that we do as PAs in the field. Things that I don't consider quality patient care experience are a CNA or a patient transport. So a patient care transporter would actually count as healthcare experience and not a patient care experience. But when it comes to CNA, you don't really do much that has to do with what we do as a PA in the field. It's more cleaning and helping take care of the patient with delivering food and stuff like that. So it doesn't really give you a good competitive edge as compared to other jobs that you can get for patient care experience. And last thing, I swear it's the last thing, my favorite thing for healthcare experience, if you do start with that, is a medical scribe, because it exposes you to a lot of different medical terminology and different diagnoses that you will later hear in PA school. And it's also a good door opener as well to finding jobs that will count as patient care experience. So that's it for today. Thank you guys so much for watching. I wanted to keep this short and sweet and straight to the point. If you have any questions, please comment them down below. Follow me on Instagram. I always put both of them, somewhere here. Yeah, thank you again for watching. Subscribe if you haven't already. If you guys have any topics that you want me to cover, please comment them down below, and I will see you for my next video.